I'm Roberto Iacovelli. I'm presenting you the results of the ARIES trial that are reported at the ASCO GU meeting. As we know, cisplatin-based chemotherapy is the most recommended option for patients affected by advanced urothelial cancer, but unfortunately, 50% of patients are considered cisplatin ineligible, and some of these patients are also considered platinum ineligible at all. These patients are generally poor prognosis, are frequently frailer and elderly compared to cisplatin-eligible patients. We know that avelumab is in a human immunoglobulin against PD-L1. Avelumab may restore immune function, is also characterized by antibody-dependent cellular cytotoxicity, and is currently approved for the maintenance treatment for patients with responsive or stable disease after platinum-based chemotherapy in advanced urothelial cancer. In this ARIES trial, we aim to investigate if patients considered cisplatin ineligible may be treated with avelumab as a first-line option and only with avelumab. And we aim to investigate the activity and safety of avelumab for this group of patients. Specifically, we screened 198 patients to find patients with PD-L1 positive expression on tumor cells, and we found that 71 patients have been found to be positive and also considered cisplatin ineligible. And these patients have been treated with avelumab 10 milligrams per kilo every 2 weeks until progression of disease, unacceptable toxicity, patient or physician decision, and the primary endpoint was 1 year overall survival. We reported the first analysis of the study after a median follow-up of 9 months. The median overall survival was 10 months, and the rate of patients alive at 1 year was 40.8%. We also investigate the outcome based in terms of PD-L1 expression, and we found that patients with a combined positive score of 10% or more have a longer overall survival. This was 13 months compared to 7 months for those with lower expression of combined positive score for PD-L1, but this difference was not found to be significant. In terms of response rate, we reported 1 complete response, 21% of patients with partial response, and another 21% of patients with stable disease. And finally, the tumor control rate was greater than 40%. No new signals in terms of safety have been reported, no treatment-related deaths, and only 3 high-grade treatment-related adverse events, and these were infusion reaction, grade 3 infusion reaction in all 3 cases. Finally, this study supports the idea that chemotherapy is remain the standard of care for patients considered cisplatin ineligible, but some patients that are not eligible to chemotherapy at all may be treated with immunotherapy, and we know that pembrolizumab and atezolizumab are currently approved for this group of patients, and ARIES trial add another piece of evidence supporting the activity of immunotherapy in this group of patients. Of course, these patients remain with a poor prognosis, and we have to work to find specifically predictive factors that may improve the outcome of these patients to chemo or to immunotherapy, and finally increase the overall survival of this patient.